Okay, so the first thing you guys remember is that the two arteries that supply the majority of the blood to the brain is going to be the internal carotid artery and the vertebral artery, right? Internal carotid artery is going to go through the carotid sinus. The vertebral artery goes through the foramen magnum. Okay, so that's going to supply oxygen and the nutrients to the brain. Okay, but we need to take the carbon dioxide and the waste products back out of that and deliver it back toward general circulation. So the part of the vessels that are going to help do that are referred to as sinuses. You probably did a little bit of this in Anatomy 1. You may have done it in Anatomy 1. So the first one we're going to talk about that's going to deliver it back toward the general circulation, venous blood, is going to be this right here, which is known as the superior sagittal sinus. This is the superior sagittal sinus. Okay? The superior sagittal sinus is going to bring blood back to this area right here, okay, to this little area right here, this little confluence, which we'll get to in a second. Okay? This, actually we'll name it right now. This right here is known as the confluence of sinuses. The reason it's called the confluence of sinuses is because the superior sagittal sinus drains into it. There is an inferior sagittal sinus. This model does not have it. This model does, and I'll get that in a minute for you once I find it in here. It's actually over there in the back. But the inferior sagittal sinus drains back to there. The superior sagittal sinus drains back into what we call, again, the confluence of sinuses. Once it gets to the confluence of sinuses, it then drains into this vessel right here, which is known as the transverse sinus. So again, superior sagittal sinus, confluence of sinuses, transverse sinus. Okay. As we go down, it then forms an S-shaped structure, and you can see the S-shaped structure in here. I can put a sticker on this for both the inside and outside, okay, of this model. So this right here is called the sigmoid sinus, and why is it called sigmoid sinus? Because it has an S shape to it. Okay, just remember like the sigmoid colon and the sigmoid vessels we talked about. This is the sigmoid sinus. The sigmoid sinus brings deoxygenated blood back to this jelly bean shaped hole in the skull. Now there's a vessel that goes through that jelly bean shaped structure in the skull. And what is the name of that hole, that jelly bean shaped hole?
Jugular foramen.
Jugular foramen, very good. And the vessel that goes through there is the internal jugular vein. Does everybody understand that? So the internal jugular vein is going to be right there, go through the jugular foramen. So again, you'd have the superior sagittal sinus, inferior sagittal sinus drains to the confluence of sinuses drains to the transverse sinus down to the sigmoid sinus, which we find inside, and then through the jugular foramen into the internal jugular vein. The internal jugular vein you can also see right here. Thank you. This right here is the internal jugular vein. The internal jugular vein is then going to drain into this vein right here, which is known as the subclavian vein. The subclavian vein, once you pass this point, okay, so over here this is called the subclavian vein. So this direction is called the left brachiocephalic vein. Left brachiocephalic vein drains then into the superior vena cava, and then from the superior vena cava, it's then going to drain into the right atrium. Does everybody get that? Okay. Now the external part, okay, which is going to drain the superficial blood of the head, is going to go into the where? What do you think? If inside the head is going to be drained into the internal jugular vein, what do you think the external jugular vein is going to drain into? The external part of the face is going to drain into the what? External jugular vein. Good. Okay. So this right here, this little opening right here, is the internal, the external jugular vein. This right here is the internal, and this right here is the what? External. Drains into this vessel right here, which is called the what? Subclavian. Good. So drains into the subclavian. We also see this here. This right here is the internal jugular vein, because it's going inside, or draining from inside, and this is the what? External jugular vein. Draining into the subclavian, left brachiocephalic, superior vena cava. This right here, therefore, is what vessel? Right subclavian. The right subclavian. Okay? So that's the right subclavian. Okay, just hit stop on your